Um,
Electroconvulsive therapy?
No, never heard of it, no.
I haven't even heard that term in years.
My experience on convulsive therapy with electrodes is limited.
ECT's been around for a very long time, and it's gotten a very bad rap.
They said make you kind of crazy like.
Something to do with your frontal lobotomy.
The general public is maybe frightened or have misperceptions about electroconvulsive therapy. They think of it as rather invasive. It's not invasive. It's not related to like a lobotomy. ECT stands for electroconvulsive therapy. Typically, ECT requires 6 to 12 treatments done 3 times a week. So it's usually 3 to 4 weeks of treatment. Electroconvulsive therapy can be effective for patients with major depressive disorder, bipolar disorder. It can be life-saving in situations where patients are suffering from acute suicidality or catatonia. The procedure is fairly straightforward. It involves preparation of the patient, which involves placing electrodes on their head to monitor that they're having a seizure. We put on EKG leads on their chest to monitor their heart rate, their blood pressure, their oxygen, so they're carefully monitored during the procedure. The patient is asleep for only about 10 minutes, the procedure itself, but from start to finish in terms of preparation to patient recovery, it takes about an hour.
Well, I did see the movie One Flew Over the Cuckoo's Nest, and its portrayal of electroconvulsive therapy was at best difficult.
It makes me feel a bit queasy. It looks a bit terrifying, and it definitely looks painful.
Would ECT be something I'm willing to do? No.
No, because I saw what happened to the guy in the movie, so I wouldn't know.
I think the movie One Flew Over the Cuckoo's Nest has done more to make this treatment controversial than any other treatment in medicine.
ECT is not how it is portrayed, and it has scared veterans and patients from considering this very effective treatment, and it is in fact a very safe procedure. ECT is the most effective treatment we have for depression.
Well, it was presented to me by my doctor after a trial of various drug therapies and was having a lot of problems with side effects. They felt that I was a good candidate for ECT. And I thought about it and I thought, okay, we'll try it, because I like the idea of less drugs.
I was in the Navy from 1982 to 1988 as a CTM, cryptologic technician. I suffered depression for many years, and I tried it seemed like every type of medication I could think of. There had to be something else out there, so I started doing research. I'd heard of ECT before. I asked if that was a viable option.
I was in the service in the late 60s, early 70s, spent time in Southeast Asia. I developed Parkinson's. One of the side effects that comes along with Parkinson's is depression. And one of the procedures I'm doing is ECT. And the reason I'm doing that is my psychiatrist and I were trying to decide on how to deal with this.
Electroconvulsive therapy can be effective within days, within a few treatments. In terms of the efficacy of electroconvulsive therapy, it's the most effective treatment we have for depression. We see success rates or efficacy of 80 to 90%, which is unheard of in psychiatry. Veterans and patients who have undergone this procedure will tell you that this is a life-saving procedure and how this procedure has greatly improved their lives.
What I'm doing now with the ECT that I wasn't doing before is I'm working, which makes me feel like I'm contributing again, which is a really good way to feel, because before that I wasn't capable of working, I wasn't capable of taking care of myself. But now I don't have any more hiccups about that, you know? I just go and I do it.
I started doing photography about 3 years ago as therapy. A couple guys at the VA that I go to in Newington started taking pictures, so we started out to be a photography club. We will go out places, take pictures. If I hadn't had ECT, I probably wouldn't be doing photography. I probably wouldn't be doing a lot of things because I just feel better.
Working as an architect, it became almost impossible to keep going, only because of the meds and the tremors, which then complicated the depressions. So I've been fortunate that the VA is very supportive and has an excellent regimen for dealing with these type of scenarios. One of the drawbacks that ECT has is memory loss, and it's a very short-term memory loss, it's not long-term. Mine happened to affect my math skills, but I'm working on a project now as an architect, and it has all come back, and I don't have any problems at all with it now.
In general, ECT is among the safest procedures administered under general anesthesia, and it's generally well tolerated by patients. Most side effects are mild and can be treated with over-the-counter therapies or other treatments the doctor will give at the same time as the procedure. The side effect that people most worry about is memory loss. Fortunately, over the last 20 to 30 years, advancements in the field have greatly reduced the probability and severity of memory problems. It's also fortunate that most memory problems resolve shortly after the acute treatment period.
Well, with ECT, I don't really have any side effects after I go through the procedure.
ECT has made a big difference in my life. It brought a lot of things back, and I find participating in life is very important. I don't mind being in the wheelchair. It's okay, as long as I can participate. The ECT has brought that back now to where I am starting to go back and do all these other road races and play golf and do all the things that I want to do.
I just feel so much freer because I just feel all right with the world. It's a good feeling. I feel like I'm being taken care of by good people.
After I have ECT, I've got a little bit more pep in my step. I'm smiling more. My friends notice, my family notice, and they can tell when I haven't had it for a while, because after the ECT, there's a big difference.
Thanks to the caregivers at the VA. They're very concerned. They want to help you, and they actually have a tool that works that will help you.
It's better to open to something new rather than to live with a disorder.
If something can help you, shouldn't have fear. I know personally some people who have made some real gains with the help of ECT.
ECT has changed my life.
It's given me back a lot that I was concerned I would not be able to get back.
I'm just a new person because of it. And I just think you should give it a try.